Vice Chair Santana did the hard part, and now we will go right into testimony. Today we have House Bills 4579, 4580, 4131, and 4213, all regarding telehealth here in the state of Michigan. And I will invite all of the bill sponsors up if you'd like to do it that way, or if you want to come one at a time. Next, we're going to bring up Dr. Michele Reid, Chief Medical Officer for CNS Healthcare. Dr. Reid, please begin whenever you're ready. You want to come up as well? Oh. All right, thank you very much.
Thank you. For us to share our perspectives from CNS Healthcare and the Guidance Center, 2 certified community behavioral health clinics, and we're also representing the Michigan Behavioral Health and Wellness Collaborative, and we are in support of House Bills 4579, 4580, 4311, and 4213. I'm a community psychiatrist. I spent my entire career working in community mental health in Michigan, and I'm the Vice President and Chief Operating Officer of CNS Healthcare. And we operate in Wayne, Oakland, and Macomb counties in Michigan, and we're passionate about expansion of certified community behavioral health clinics nationwide to improve access to mental health and addiction treatment. We really thank you for your time to talk with us about this. And what we're really concerned about, I think that Senator Guys mentioned the study from the Alterum Institute that looked at claims from 2016 and 2019 in Michigan and identified that 32% of Michiganders with any mental illness were totally untreated, and about 72% of Michiganders with substance use disorders receive no treatment. And each year, that's like 1 million people who need care who are not getting it. So we feel that passing these bills will be important, but we also feel and have testified before about 2 bills that actually passed the state of Michigan in 2020, and that was Public Act 98 and 101 of 2020, and they did establish the right to have telehealth services, both audio only and audio visual. And one of my main concerns is restrictions from the Michigan Department of Health and Human Services, even though it's law that says we must cover audio only and audio and visual. They put rules in place this past May that were restricting audio only services, which, as you point out, is a problem for people who don't have access to broadband or Wi-Fi. And that basically, in many cases, for the majority of services we provide, the audio only restrictions still provide. And so the telehealth services are not uniformly accessible, even though the bill passed. So we feel that the audio only restrictions by the Michigan Department of Health and Human Services is really contrary to the current law. These bills help clarify the current law and address these restrictions, so we're all in favor of it. And I will end, before turning it over to Lori, with my own personal experience with telehealth. The pandemic came, many providers were shut down, and where I went to see one of my specialists, the clinic was closed down, and they opened up in March of 2020 providing telehealth services. The doctor moved from the office in Royal Oak all the way out to Rochester, and they closed at 5 o'clock. They used to be open from 8 in the morning to 8 at night, and they were open every Saturday from 8 to 1. And I work in Novi, I live in Farmington Hills, so I'm driving across the county to get there. Fast forward, the clinic closes at 5 o'clock Monday through Thursday, and on Friday they close at 12 o'clock, and they're not open on Saturdays anymore. I have not seen Dr. Miller in person for over 3 years. I have been able to sit at home or my office in Novi and continue continuity of care there. If she orders lab work, I go to a lab outpost near my home. If I need a test done, an x-ray, I go to x-ray by my home. And it's been just a godsend for me to maintain my own health care despite having a family and managing my own health concerns and a full-time job. That it's been invaluable for me. I get up in the morning, I take my vital signs, I have everything ready, and we're able to talk. I've not seen her in person in 3 years, and I don't know that I would again. Occasionally, when the Epic system didn't work, I've had my sessions with her telephone only. So I'm here to say that the audio-only services work fine, and I think everybody should have access to them. Thank you. I turn it over to Laura.
Thank you, Senator Hertel and members of the committee for allowing us to speak on this issue. I'm Laura Huot. I'm the Chief Operating Officer at the Guidance Center. The Guidance Center is a multi-service organization located in Wayne County. We have one office in Detroit, but we primarily serve the downriver area, and we've been doing this for more than 60 years. We have other services, but by far the largest service line we have is behavioral health. We serve people pre-birth. We start working with pregnant moms, and we work with babies all the way through adulthood. We see people with mild to moderate conditions and people with more severe conditions. And we have found that telehealth works for all of these different populations that we serve. But I want to talk a little bit about our substance use disorder services. Several years ago, we noted that 7 out of the 10 communities that had the highest rate of deaths in Michigan from prescription opioids were in our service area. They were downriver. So we really felt a sense of responsibility to do something about it. At that time, reimbursement rates for SUD services were very low, so we had a really small program. 2 part-time staff was all we had. We were serving only about 100 people over the course of an entire year. Thank God for CCBHC, because that funding has allowed us to expand. So this fiscal year, we're going to be serving more than 700 people in that program alone. All total at the Guidance Center, we serve about 15,000 people a year. But our substance use disorder program especially relies on telehealth. We have a large number of people, about 30% of the people we serve in that program have private insurance. They're working, they're getting referred by drug courts and sobriety courts in the area. And we hold, at lunchtime every day, we have group therapy sessions that people can log into. So think about that. If you're working and you've got multiple times a week, you have to participate in these court-mandated sessions, and you have to get in your car and drive and tell your employer that you need the day off for this, it's going to make it very difficult for you to maintain your employment. So we have a lot of people participating in services that way. And because of that, the drug courts in the area have been very pleased with what we've been offering, and those referrals are increasing. I also want you to think about people with mild to moderate conditions or people who've had severe conditions, but they're doing really well, and they don't necessarily need to come into our office for in-person therapy on a regular basis or see their case manager. They may just need to touch base with the doctor every 3 months to maintain them on their medication and keep them from ending up having more severe symptoms. It works extremely well for that population. And also, we have our children's programs in particular, but this happens everywhere. Life happens. So we have a lot of single mothers. So think about a single mother with 3 kids in tow, and she's got a 10-year-old, and that 10-year-old's acting out in school. And if that child doesn't get help, that child's going to end up with consequences with the school. Mom goes to put all the kids in the car to come to the Guidance Center, and the little one gets sick. What is she going to do? In the past, without telehealth, she would call and say, I'm sorry, I have to cancel the session. Now we can just say, it's all right, let's hop on telehealth, whether it's on the phone or Zoom. One of the things we've been doing, though, for some of those families that you mentioned, Senator Geis, is we have been providing tablets with subscriptions for internet service so that people can continue to connect with us over telehealth. And I also want to address this idea that telehealth services don't cost as much to provide as in-person services. When you are a clinic that serves the community the way the Guidance Center and CNS Healthcare and the rest of the 15 other organizations in the My Health and Wellness Provider Collaborative do, you still need locations. We are in the process of renting another space because our substance use disorder program keeps growing and we need more space for that. Only about 5% of our costs are for facilities. More than 80% are for staffing. That's not going to change whether it's telehealth or whether it's in-person services. And those buildings are not going away either. We actually spend a little bit more now because we are providing some tablets and because we have to pay for a telehealth platform. But we value it. We could say no more telehealth at the Guidance Center, get rid of the platform and save some money, but this is very valuable to the people that we're serving. So I thank you very much for your time on behalf of the Guidance Center and the My Health and Wellness Provider Collaborative.
Thank you very much for your testimony. Minority Vice Chair Weber has a question.
Yeah, you maybe touched on it a little bit, but just give me some examples of some of the treatments that can be done via audio only. It seems to me that it would be kind of a limited amount of treatments. So-
Yeah, I mean, we do limit the audio only, primarily speaking with the psychiatrist. We really prefer that people have a combination of in-person and telehealth at the guidance center. So they may have met with their case manager in person. A lot of our children get services where sometimes the therapist goes out to the house to meet with them in the home. So somebody has touched base and saw the person in person, and then if they don't have internet connectivity and can't connect over our telehealth platform, they will have a phone call. Another thing too, are people in our substance use disorder program, so some of them do get psychiatry as well. You know, just think about, you're getting ready for work, you get a flat tire. How frustrating is that, especially if you're, you know, maybe you're low, your income is lower, you're worried, all these things are going through your head about, I'm not gonna make it to work today, oh my God, everything. That is a trigger. Those types of things, when life happens, those are triggers for relapse. And if we can get on the phone with somebody and we can have a session and help them in that moment instead of them relapsing, then we could potentially be saving a life.
At CNS Healthcare, we have provided just about every service we provide using audio only and audio visual. The one service that we were not able to provide through telehealth is people who are on long-acting medication for substance use disorders and mental disorders. You got to come into the clinic to get your injection, or we need to go out to your house. So individual therapy can be provided that way. Evaluation and management with the psychiatrist. Also, with the nurses, calling to collect the vital signs, following up on your blood pressure. Are you taking your medication? All of these services can be provided either or. Obviously, our preference would be to do audio and visual, but as Senator Geis is saying, not everybody has access. We were successful during the pandemic of working with United Way and the Federal Communications Commission and gave out over 1,000 cell phones and tablets. However, we still have people who have technology issues, so we'd like the flexibility. Obviously, audio and visual together is preferred, but we don't feel that Michigan Department of Health and Human Services should put in place rules that says, under no circumstances can you do audio only. When we did audio on 1,000 cell phones and tablets, however, we still have people who have technology issues, so we'd like the flexibility. Obviously, audio and visual together is preferred, but we don't feel that Michigan Department of Health and Human Services should put in place rules that says, under no circumstances can you do audio only. When we did audio only during the pandemic, before everybody got devices, and we had over a 500% increase in telehealth services, served the last 4 years over 13,000 people using telehealth. So a combination of audio only and audio and visual.
I agree, absolutely. Yeah, we want those decisions to be made by the people that we're serving in conjunction with the treatment team and made on an individual basis.
Thank you very much. Senator Geis.
Thank you, Mr. Chair, and thank you both for your testimony. I was really shocked to hear that DHHS put that rule in place, especially for those reasons, like the most vulnerable folks, the ones who interface with the DHHS system. So I do, and also being from downriver and knowing that many of our residents are income constrained, so being able to provide them those the hardware to be able to access their appointments is fantastic. I know exactly where our guidance center is. I do want to highlight though that even downriver, and in many other parts of our states, there are spots in downriver where we might as well be rural, because even on audio only, there are entire dead zones for calls. So making sure, I just want to make sure that however that service is delivered, that infrastructure is there so that people can access.
Absolutely. That's why
their
we
appointments.
that's why we won't get rid of our buildings and we won't stop doing a combination of telehealth and in-person services. In that situation, we'd send somebody out to the home to see the individual, or we would have a case manager or a peer go and pick the person up and bring them to the office. We need the full array of services and options available.
And for your information, the testimony, I did include the 2 earlier bills that passed in 2020, along with the May 2023 MDHHS policy change.
I remember those bills. So thank you. Thanks.
Thank you. Seeing no further questions from the committee, we appreciate your testimony today. Thank you for being
Thank
here.
you so much, and our deepest gratitude to you, Chair Hertel, for having us, and we thank you for your time and attention to these important health-related matters. Thank you.
Thank you for all the work you do. We're going to continue the conversation with the representatives. I want to thank them for bringing it forward and hopefully move these bills in a future meeting. And without any further business before the committee, we are adjourned.
Great job, Mr. Chair.
Thank you very much for your help. Thank you for starting it.
My question was going to be for